Okay, so today we will discuss about techniques of supervision, means how we perform the supervision. The technique of supervision include observation, just by observing, and along with this we also supervise through guidance and demonstration. Okay, along with this we have another technique that is known as checking record and report. Okay, so what are these techniques? We will discuss them along with conferences and meetings with the staff, then field visit and rounds in the wards, hospital or in the health centers, then supportive supervision, and finally evaluation and giving feedbacks. So these 7 points, these are known as techniques of supervision. So first of all, one very important technique is observation. Okay, and this observation can be made everywhere when the supervisee or the subordinate staff is doing his or her work. Okay, so directly observing the work of staff or students or supervisee is known as the technique of supervision, which is just observation. Okay, this technique helps to identify the strength and the areas of improvement. Okay, because we are directly observing the client, so how he or she is performing her or his activity, what are his strength and what are her weakness, we can identify just by observing. Okay, this observation can be planned or unplanned. Okay, if it is planned, then we can ask the client or the supervisor that I am coming on this date for supervision or observation, when you will be doing your clinic or when you will be doing your home visit or anything. Okay, and unplanned, just going to the center and observing. Okay, so these observation can be planned or unplanned. Example of this type of supervision will be watching an ANM while she is doing immunization clinic to assess the techniques of injection as well as how she is communicating with patients. Okay, so this is the technique of supervision known as observation. Okay, so we supervise through observation. Then another technique we can use, that is guidance and demonstration. Okay, in observation we are not actively participating. Okay, we are just observing, but here in this technique we are directly taking part in the process. Okay, how? We demonstrate the correct procedure and skill. For example, if we have there, we are there on the site of clinic, then we can demonstrate how to give injection. Okay, how to use aseptic technique, how we are throwing the biomedical waste. Okay, so this system will be known as demonstration and guidance, because we are in the supervision. It is not only observation, it is guiding, it is a type of training, so we explain them through the demonstration. Okay, so demonstrating the correct procedure or skill, even giving individual or group guidance. Okay, if only one staff is there, we can give individual guidance or the group guidance. Here we encourage learning by doing. Okay, because we are doing, and this doing encourages learning, because the client will observe and learn. Okay. Then example here, the demonstrating the proper hand washing procedure before any activity or procedure, this we can say. Okay, or demonstrating the injection technique, this we can tell them. Okay, so this system is known as guidance and demonstration. Next technique of supervision is checking the records and reports. Okay, apart from observation and demonstration, we can visit any center and we will check the record or registers maintained by the staff. How she is writing the records, how she is maintaining the register, her handwriting, using of proper formats. Okay, we can check. If she is maintaining the records well, then we can give very good marks, or we can write in the report that she is doing very well. Okay. During this checking, what we will check? We will review the registers, reports and any documentation made by the staff. Okay. We ensure the accuracy and completeness. We will see and we will check that these records are maintained accurately and they are complete in nature. Okay, this we will check. This helps to identify the service gaps or errors. Okay, we can check that if there are service gaps or she has not given some immunization in the areas, then the gap will be there, because when we will check the immunization register, we can find out any lacking in the immunization services. Okay, so through this we can check. Example, here it is given just checking the ANC register for completeness in the and entries making, and even we can write that just we can check the immunization register whether it is complete or okay. So in this what we will do, we will check the record and report of the made by the supervisee or staff. Then conferences or meeting. Okay, we can call meetings individually or with the staff of all staff of our PHC, including sub-centers, and through these meetings we can supervise the client. Conduct individual or group conferences to discuss the performance, promote open communication and problem solving. We can discuss these points. These meetings can be on daily basis, weekly basis or monthly basis. Normally we conduct meetings monthly basis, okay, on the PHCs, where all ANMs from the sub-center they come and we conduct the meetings. Okay. Example, staff meeting to review the immunization coverage. Okay, through this we can supervise. Next technique is field visit and rounds. Okay, we can visit the community during home visits. When the ANM is going for home visit, the supervisor will also come, accompany and check how she is performing. Okay. So supervisor visit health facility or community sites, observe activities and interact with the client, and offer on the spot support and feedback to the supervisee. Okay. Example, LHV visiting the sub-centers or accompany ANM for supervision during the home visits. Okay, this is another technique. Then supportive supervision. Supportive supervision means supervision and same time she is supporting the staff. Okay, explaining or giving training to the staff. Encourage mentoring, coaching and motivation. Okay, emphasize problem solving rather than fault finding. Okay, because we are not there to find the faults in the staff, we are just to support or encourage. Okay, this build staff confidence and teamwork, and our goal during supportive supervision is continuous improvement, not punishment. Okay, so this is another very good technique for supervision, and mostly nowadays supervisors use this type of technique. Then finally evaluation and feedback. So what we have done in all types of techniques, supervision, observation, checking the records and report. After that we prepare a report and submit to our higher authorities. Okay, and sometimes we also give feedback to the staff. Okay, how you have performed, we can tell them. So comparing the performance with the set standards means what were the standards, what were the goals and what you have achieved. This we will tell to the staff. We will also make a report of this, provide constructive feedback and encourage self-assessment. We also encourage self-assessment. Okay, how much marks you will give to yourself? We can ask. Okay, so they can understand that what we have told to them. Feedback should be specific, timely, and supportive. For example, finding error in reporting and telling the correct technique of calculation. If she has made any mistake in preparing report, then we can tell them how you should make the report. Simple. Okay. So this is all about techniques of supervision.